This multivitamin, mineral, and fatty acid product, known as Wesnate Dha 28 mg Iron-1 Mg-200 Capsule Multivitamins, is used to treat or prevent vitamin deficiency before, during, and after pregnancy. It contains important building blocks of the body, such as vitamins, minerals, and fatty acids, which help keep you in good health. Additionally, it also contains iron and folic acid, which are crucial for women of childbearing age to maintain adequate levels of to prevent infant spinal cord defects in the developing baby. It is recommended to take this medication as directed by your healthcare professional, and it is best to take it with food to help with absorption. When taking Wesnate Dha 28 mg Iron-1 Mg-200 Capsule Multivitamins, it's important to follow your doctor's directions. You can take it once or twice daily, as recommended. If you're taking the powder form, mix it with water before swallowing. If it's delayed release, don't crush or chew it. It's best to take this medication on an empty stomach, 1 hour before or 2 hours after meals, with a full glass of water. If you experience stomach upset, you can take it with food. Remember to take it regularly at the same times each day to get the most benefit from it. Avoid antacids, dairy products, tea, or coffee within 2 hours before or after taking this medication, as they can decrease its effectiveness. And make sure not to lie down for at least 10 minutes after taking it. Be sure to consult your doctor or pharmacist for details specific to your particular brand. Some common side effects of Wesnate Dha 28 mg Iron-1 Mg-200 Capsule Multivitamins may include constipation, diarrhea, or upset stomach. These are usually temporary and may go away as your body gets used to the medication. Iron in this medication may cause your stools to turn black, which is not harmful. Serious side effects are rare, but it's important to tell your doctor if you experience easy bleeding or bruising. If you notice any symptoms of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing, seek medical help immediately. There may be other side effects not listed here, so it's important to contact your doctor or pharmacist if you notice anything unusual. As always, remember that this medication has been prescribed to you because the benefits outweigh the potential risks. It's important to follow your doctor's guidance and take the medication as directed. If you have any concerns about the side effects, dosage, or timing of taking this medication, be sure to discuss them with your healthcare provider. Accidental overdose of products containing iron can be very dangerous, especially for children under the age of 6. It's important to keep this multivitamin capsule out of reach of children at all times. If an overdose does happen, seek medical help immediately or contact a poison control center. Before starting to take Wesnate Dha 28 mg Iron-1 Mg-200 Capsule Multivitamins, make sure to inform your doctor or pharmacist if you have any allergies to its ingredients, fish, or soy/peanuts. Also, discuss your medical history with them, especially if you have iron overload disorder, alcohol abuse, liver problems, stomach/intestinal problems, vitamin B12 deficiency, or bleeding disorders. If you are pregnant or breastfeeding, be sure to use this medication as directed and consult your doctor before doing so. As for the uses of Wesnate Dha 28 mg Iron-1 Mg-200 Capsule Multivitamins, it helps in preventing or treating vitamin deficiency due to poor diet, certain illnesses, or during pregnancy. It is also used to improve the body's iron levels and overall health. The recommended daily dosage is determined by your doctor based on your age, gender, medical condition, and response to treatment. It is best to take this medication with food to help prevent stomach upset. And for optimal timing, it is usually best to take it at the same time each day to help you remember. It's important to be aware of any potential drug interactions when taking Wesnate Dha 28 mg Iron-1 Mg-200 Capsule Multivitamins. Certain medications, such as chloramphenicol, certain anti-seizure drugs, and methyldopa, may interact with this product, affecting how your medications work or increasing your risk for serious side effects. Additionally, this product can decrease the absorption of other drugs, such as bisphosphonates, levodopa, penicillamine, quinolone antibiotics, thyroid medications, and tetracycline antibiotics. It's recommended to separate your doses of these medications as far as possible from your doses of this product. We advise consulting your doctor or pharmacist about how long you should wait between doses and for help finding a dosing schedule that will work with all your medications. If you suspect an overdose and the person is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. In the U.S., you can reach the local poison control center at 1-800-222-1222, while Canadian residents can contact their provincial poison control center. Symptoms of an overdose may include stomach pain, nausea, vomiting, and diarrhea. Always seek professional help in case of an overdose. Remember, it's important not to share this medication with others. While taking this product, you may need to undergo lab and/or medical tests, such as a complete blood count or checking your vitamin B12 levels. Make sure to keep all medical and lab appointments and consult your doctor for more details. It's worth noting that some brands of prenatal vitamins may also contain calcium, zinc, iodine, or docusate. If you have questions about the ingredients in your brand, be sure to consult your doctor or pharmacist. Lastly, it's important to remember that this product is not a substitute for a proper diet. It's always best to get your vitamins and minerals from healthy foods. Make sure to maintain a well-balanced diet and follow any dietary guidelines as directed by your doctor. If you forget to take a dose, take it as soon as you remember. If it is close to the time of your next dose, then just skip the missed dose. Take your next dose at the usual time. Do not take a double dose to make up for the missed one. When it comes to storing Wesnate Dha 28 mg Iron-1 Mg-200 capsule multivitamins, it's important to keep them at room temperature and away from light and moisture. Make sure not to store them in the bathroom, and always keep them out of reach of children and pets. When it's time to get rid of this product, don't flush it down the toilet or pour it into a drain unless specifically instructed. Instead, properly discard it when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.